Junel Fe is a combination hormone medication that is used to prevent pregnancy. It contains two hormones, norethindrone and ethinyl estradiol. In addition, there is a small amount of iron in each of the 7 inactive tablets taken during the 4th week. These inactive pills do not contain any hormones and are meant to keep you in the habit of taking 1 tablet each day. However, they do not contain enough iron to treat iron deficiency. In addition to preventing pregnancy, Junel Fe may also make your periods more regular, decrease blood loss and painful periods, decrease your risk of ovarian cysts, and treat acne. It is important to note that using this medication does not protect you or your partner against sexually transmitted diseases. When taking Junel Fe, it is important to follow the prescribed daily dosage and take it at the same time every day for optimal effectiveness. It is best to discuss the optimal timing for taking Junel Fe with your healthcare provider. Before you start taking Junel Fe, be sure to read the patient information leaflet provided by your pharmacist. This contains important information on when to take your pills and what to do if you miss a dose. If you have any questions, ask your doctor or pharmacist. You should take this medication by mouth as directed by your doctor, usually once daily. Choose a time of day that is easy for you to remember, and take your pill at the same time each day. If you are taking the chewable tablet, you may either swallow it whole or chew it thoroughly and swallow. It's crucial to continue taking this medication exactly as prescribed by your doctor. Follow the package instructions to find the first tablet, start with the first tablet in the pack, and take them in the correct order. Do not skip any doses. If you experience vomiting or diarrhea, it can affect the effectiveness of the birth control pills. In this case, you may need to use a backup birth control method, such as condoms, spermicide. Taking this medication after your evening meal or at bedtime may help if you have any stomach upset or nausea with the medication. You may choose to take this medication at another time of day that is easier for you to remember, but it's important to take it at the same time each day, 24 hours apart. Your pill pack contains 21 pills with active medication and 7 reminder pills with iron. Take 1 active pill, with hormones, once daily for 21 days in a row, and then 1 inactive pill, with iron, once daily for 7 days in a row after you have taken the last active pill unless otherwise directed by your doctor. You should have your period during the 4th week of the pack. If you are taking certain medications that can interact with iron, ask your doctor whether you should throw away the reminder pills, iron tablets, each day rather than taking them. If this is the first time you are using this medication and you are not switching from another form of hormonal birth control, take the first tablet in the pack on the first Sunday following the beginning of your menstrual period or on the first day of your period. Use an additional form of non-hormonal birth control, such as condoms, spermicide, for the first 7 days to prevent pregnancy until the medication has enough time to work. If you start on the first day of your period, you do not need to use backup birth control the first week. Ask your doctor or pharmacist for information about how to switch from other forms of hormonal birth control to this product. If any information is unclear, consult the patient information leaflet or your doctor or pharmacist. If you experience nausea, vomiting, headache, bloating, breast tenderness, or swelling of the ankles/feet, these could be common side effects of Junel Fe. You may also experience vaginal bleeding between periods or missed/irregular periods, especially during the first few months of use. If any of these side effects persist or worsen, it's important to notify your doctor or pharmacist. It's important to remember that your doctor has prescribed this medication because they have determined that the benefits outweigh the potential risks. Many people who use this medication do not experience serious side effects. Junel Fe may also increase your blood pressure, so it's important to monitor it regularly and inform your doctor if it becomes elevated. You should also contact your doctor immediately if you experience any serious side effects, such as lumps in the breast, mental/mood changes, severe stomach/abdominal pain, unusual changes in vaginal bleeding, dark urine, or yellowing of the eyes/skin. In rare cases, Junel Fe may cause serious problems related to blood clots, such as deep vein thrombosis, heart attack, pulmonary embolism, or stroke. Seek medical help immediately if you experience symptoms such as chest/jaw/left arm pain, confusion, sudden dizziness/fainting, pain/swelling/warmth in the groin/calf, trouble speaking, sudden shortness of breath, unusual headaches, weakness on one side of the body, or vision problems/changes. If you notice any signs of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help right away. It's important to note that this is not a complete list of possible side effects, so if you experience any other effects, be sure to contact your doctor or pharmacist. It's important to note that Junel Fe should not be used if you smoke cigarettes or use tobacco and are over 35 years old. This is because smoking can increase the risk of serious health problems such as stroke, heart attack, blood clots, and high blood pressure when using hormonal birth control. Additionally, it's crucial to keep Junel Fe out of reach of children, as accidental overdose of iron-containing products is a leading cause of fatal poisoning in children under 6 years old. If overdose does occur, it's important to seek medical help immediately or call a poison control center. As for the daily dosage and optimal timing of taking Junel Fe, it is best to follow the instructions provided by your healthcare provider. They will be able to give you the most accurate information tailored to your individual needs. Before taking Junel Fe, it's important to let your doctor know about any allergies you have, especially to ethinyl estradiol, norethindrone, ferrous fumarate or other estrogens, progestins, or iron products. Also discuss any medical history of blood clots, high blood pressure, cancer, diabetes, heart problems, liver or kidney disease, and any recent or upcoming surgeries. If you have diabetes, it's important to monitor your blood sugar regularly while taking Junel Fe, and inform your doctor of any changes. It's also important to inform your doctor if you will be in a situation where you will be confined to a bed or chair for a long time, as this can increase the risk of blood clots. Junel Fe may cause blotchy, dark areas on your face and skin, so it's important to limit sun exposure, use sunscreen, and wear protective clothing when outdoors. Additionally, if you are nearsighted or wear contact lenses, you may experience vision problems, so it's important to contact your eye doctor if needed. It's important to note that it may take longer to become pregnant after stopping Junel Fe, so it's advised to consult with your doctor. It's also important to avoid using Junel Fe during pregnancy, and to inform your doctor if you become pregnant while taking this medication. If you are breastfeeding, it's important to consult with your doctor before continuing to breastfeed while taking Junel Fe, as it may decrease breast milk production and have undesirable effects on the nursing infant. When taking Junel Fe, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. Some products that may interact with Junel Fe include aromatase inhibitors, fezolinetant, aspemifene, tamoxifen, tizanidine, tranexamic acid, and certain combination products used to treat chronic hepatitis C. Additionally, some drugs may cause hormonal birth control to work less effectively, potentially leading to pregnancy. It's important to inform your doctor of any new medications you start, as they may recommend additional reliable birth control. Furthermore, Junel Fe may interfere with certain lab tests, so be sure to let lab personnel and your doctors know that you are taking this medication. If you or someone you know has taken too much Junel Fe and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call the Poison Control Center at 1-800-222-1222, while residents of Canada can reach out to their provincial Poison Control Center. Symptoms of an overdose may include intense nausea and vomiting, as well as unexpected vaginal bleeding. It is important not to share Junel Fe with others. You should have regular physical exams while taking this medication, including lab tests such as blood pressure, breast exam, pelvic exam, and pap smear. Follow your doctor's instructions for examining your breasts and report any lumps right away. It's important to keep all medical and lab appointments. Make sure to consult your doctor for more details. If you miss a dose, refer to the product package information for guidance. You may also need to use additional birth control methods, such as condoms or spermicide, to prevent pregnancy. If you frequently forget to take your pills, talk to your doctor about switching to a different form of birth control. Make sure to store Junel Fe at room temperature, away from light and moisture. It's important to keep it out of the bathroom and away from children and pets. When it comes to disposing of Junel Fe, don't flush it down the toilet or pour it into a drain unless specifically directed to do so. Properly discard the product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.